Record, and we are on. So hello. This is Dr. Kevin Connors. It's our Zoom call for the 13th of June. I think it's the 13th of June, a Wednesday, and it's just a beautiful day here in Minnesota. Today we're going to talk about several things, mainly on IGF-1. IGF-1 is insulin growth factor 1. It is one of the growth factors or growth stimulators in our body that helps us heal. So let's jump right into this because I talk about IGF-1 a lot, but I've never really defined it and what it is. IGF-1 is produced through growth hormone from the pituitary gland. Pituitary gland, it goes into the liver, it's converted to IGF-1. There's many IGF products, but IGF-1 is the majority that is studied. It helps with development and growth of bone. It helps with bone protection, development and growth and protection of the brain and of the heart. It can be anti-inflammatory. It is a vasodilator, so it can be beneficial for people who have high blood pressure. And one thought is this is with a lower IGF-1 as we age, which typically is true with everyone, our IGF-1 levels decrease as we age. That is one piece of the blood pressure issue, and information about Alzheimer's is connected to that too, but it's with high IGF-1s. IGF-1 is essential for thymus development and function, making of your red blood cells, immune cell function, your kidney function and development, making follicles in the ovary and testicular function. So it has some great functions. Now there's a lot of use with IGF-1. Let's see if I put this on the other slide. With cellular regeneration and repair. So people that have severe autoimmune diseases, they're starting to use, in some circles, growth hormones and IGF-1 to raise those levels because it can increase muscle, bone, and tissue growth. It's used in the anti-aging market, stimulation with growth hormone and IGF-1 to make a person feel more youthful, feel more energetic, take away some aches and pains. So you start thinking, wow, this is a really great thing. Why don't we try to do things that increase IGF-1 levels? Well, if you have cancer or even a smidgen of cancer, it increases the growth of cancer cells. So IGF-1 is something that we want to lower when a person is diagnosed with cancer, even if it's in a smoldering phase, in a phase where your IV gene is down to 6, you want to keep IGF-1 levels lower. So this is just pulled from a study here. I indexed it here, talking about IGF-1 levels here and its risk with cancer. It's really there's probably 1,000 studies out there on IGF-1 and cancer that all basically say the same thing. Increased IGF-1 levels are going to increase cancer growth. Also, there's new studies on increased IGF-1 levels with Alzheimer's. Now, IGF-1 levels will rise when we eat more food. So when humans are consuming more calories than necessary, it will rise IGF-1 levels. Now, that is a huge issue and a huge concern with all with mortality issues. So even though it's kind of a dichotomy, even though IGF-1 and growth hormone is used in the anti-aging industry, some doctors that are doing anti-aging and using growth hormones and such, because it can make a person feel better, but it actually decreases your life expectancy. So IGF-1 has been shown over and over to decrease the life expectancy of all animals. So and it's not just because of cancer. So it does increase Alzheimer's risk. It increases degeneration ultimately of the brain. So having high IGF-1 levels have a purpose in life in that it helps you heal after an injury and it helps a child grow. So children have much higher IGF-1 levels because that's part of your growth factor system. They're growing, an inch a year or whatever state that they're in. But as adults, we're not growing anymore. And if we're continuing to overconsume nutrients and foods, that is going to stimulate IGF-1 function, or if we're taking exogenous IGF-1 stimulators to try to feel more youthful, we will feel more youthful, but we will age more rapidly. There's numerous studies coming out now, and I've shared multiple of these with you at different talks that I've given on fasting mimicking diet, intermittent fasting, and time-restricted fasting. Whatever we want to call the intermittent and time-restricted are really the same thing. But the FMD is essential for cancer, and we're going to talk about that. So nutrient excess. So when we're consuming too many calories and we're starting to gain a little bit of weight around our tummy, the problem is we're rising insulin levels and IGF-1 levels, and that's stimulating more growth, more laydown of fat tissue, and if we have cancer already, it's going to be increased growth of the cancer. It's going to be an upregulation of the mTOR signaling, and we talked about the mTOR pathway multiple times. IGF-1 is just one of those stimulators that's going to upregulate or increase the mTOR pathway, which is going to increase growth. All this is the growth pathway. How your body will take in new nutrients, make more cells, increase growth of cells. So if we have cancer, we do not want to upregulate mTOR. We do not want to upregulate IGF-1. Excess nutrients decreases the NAD-NADH ratio. This is a very important ratio that I'm going to actually do a presentation on quite soon, because there's a lot of talk about using NAD, NADH supplements, and it's all about this ratio that we want to maintain. It blocks the AMP pathway, which also leads to cancer. So all these red things, if you get excess nutrients, lead to increased aging and a high cancer risk, and if we already have cancer, increased cancer growth. Calorie restriction blocks IGF-1 signaling, blocks mTOR signaling, helps balance the NAD to NADH ratio, and it increases AMP pathways, which this is an anti-cancer, anti-growth pathway. So that increases longevity of life and increase a low cancer risk. Here's another picture showing the same thing. What FMD does, that's the fasting mimicking diet, does to normal cells and tumor cells on starvation. So it really, this is what we really want to look at for tumor cells. On tumor cells, it's going to increase cell death. It's going to decrease growth because it blocks these pathways. So super important, the FMD, intermittent fasting, making sure we're not consuming too many calories. Now this, of course, gets thrown out the window if we're in a cachexic state with rapid weight loss and can't seem to hold our weight. So that's when we have to switch gears a little bit. Again, this pathway is what we're looking at. We've talked about this in multiple talks, so I won't spend any more time on that. The next question that came in was, what about Rick Simpson oil? Can we use Rick Simpson oil? Who's used Rick Simpson oil? And where do we get Rick Simpson oil? So remember, we talked about with marijuana. So let's kind of go over this a little bit. Marijuana there's 3 uses of marijuana. There's smoking marijuana. So when would I want to smoke marijuana? So smoking marijuana can that help kill cancer? No, smoking marijuana is not going to help kill cancer. Matter of fact, I'm not a fan of recreational smoking of marijuana because of what it does to the brain. Yes, it does have negative effects on the brain in long-term studies. We used to do a lot of neurofeedback testing and doing brain scans, and you could tell if this person was on marijuana or not. And we caught some kids that you're smoking marijuana. No, I'm not. Yes, you are. I can see it right here. Okay, they fessed up. So, but what does smoking marijuana do? Well, many times people in later stage cancer have pain, right? Well, smoking marijuana can help take care of pain. And it has none of the side effects of opiates or other drugs. Smoking marijuana, what else can it do? Well, lots of times people with later stage cancer have difficulty sleeping. Smoking marijuana can help increase sleep. Can help you sleep better, can give you a better night's sleep. And if you're not getting sleep, then you're not going to heal. Smoking marijuana can help decrease nausea. Well, that could be a problem with, cancer. So, boy, if that could help take care of my nausea, then I could eat better and I wouldn't be in such rapid weight loss. Well, smoking marijuana can increase appetite. Well, that's part of my problem. I don't have any appetite. I don't feel good. I got nausea. I'm exhausted. I can't sleep. My sleep is horrible and my pain is ramped up. Well, smoking marijuana can help with that. So there's a lot of things that smoking marijuana can do. Now, personally, I have not ever smoked marijuana, but some of our patients that have gone to this route, very reluctantly, some of them, have been helped tremendously. So remember that it is simply an herb that grows naturally. So just like anything else, there's some poisonous things that grow naturally too. Does that mean we're supposed to use those? No, we have to look at the benefits of it and use it wisely. The second form of marijuana is CBD oil. Now, CBD oil is the type of oil that is typically been used for people with seizures. It's extremely beneficial for seizures. And CBD oil can be in a form just like this. Now, this is an example of Rick Simpson oil or THC oil, but it can be in a form of this too. The one CBD, high potency CBD oil we have is in a paste like this as well. So CBD is in a milligram dosage. And I've had patients, I just spoke to somebody this morning that just started using CBD. The patient is in extremely amount of pain on a lot of opioids. And he said they tried CBD, it hasn't really helped, but they only tried it once. But then I asked about the milligram dosage, and she only took about 12 milligrams. So that's not going to do it. So you have to get the milligram dosage up to a high enough point that's going to help take away the pain. CBD can help with pain. There's more and more studies about CBD and cancer itself. So some cancers respond extremely well to just CBD. Now, CBD is the non-psychoactive form of the marijuana. You won't get any side effects of feeling weird and things with CBD. Even at high doses of CBD, it's extremely well tolerated. The dose that we have that comes in a form that looks a little bit different than this, but it is in a paste type form that we have is 120 milligram a day dosage of CBD. That's a very high dose. But typically a person would take anywhere between 25 milligrams a day to 150 milligrams a day, or even 300 milligrams a day of CBD, depending on what you're trying to do. And then the THC oil is the Rick Simpson's oil. That's called Rick Simpson's oil after Rick Simpson, who really kind of put it out there in using it. How you smash the bulb, you boil it down, you dissolve it in a solvent, you boil it down, and then you get it down to a paste that is like a thick molasses is what it is. And you take it on a basis of, there's multiple different dosing charts, and I'll show you in just a second, of different ways to take the Rick Simpson oil. Have we had many patients have success with Rick Simpson oil? Yes. Do I think Rick Simpson oil is great? Yes, but I don't think it's any greater than any other cancer killer that we've tested people on and use. Just with legality reasons, I can't have this in my office to test. Now, this is not legal in every state. This is only legal in states that allow typical recreational use of marijuana. And there are many states that you could get a card for cannabinoid use that is done by the state. It's done typically through a pharmacy through the state that the state appointed. And I don't know that it's in it depends on the state, but it's usually in a capsule form and not in this. And I don't know the potency of it and it varies from state to state and pharmacy to pharmacy, I'm sure. How long does a person typically take this? Person typically takes this for 90 days and then is retested. Rick Simpson's original formula is a 90-day formula, but he does suggest that you might have to do it multiple times. So it is something that you want to look at. Here's an example of the cannabis oil treatment, starting with 3 doses daily, about half the size of grain of rice. Believe me, I've had people that can only start with 1 dose of a half a size of grain of rice, because this will make you feel loopy. Whereas the CBD oil doesn't really have any side effects. The THC oil has quote-unquote side effects. It doesn't necessarily give you the high feeling that smoking marijuana gives you. It gets you right to the feeling really groggy stage. At least this is the experience that I've heard from multiple patients. So dosing it, but this is Rick Simpson's dosage, getting up to 3 doses daily of a half a grain of rice and a full grain of rice, and then you're up to getting a gram a day. So it does depend on the potency of the formula that you're using, but typically you're getting to a gram a day of the CBD oil, or the THC oil / Rick Simpson oil. That can really wipe a person out. I've had people put their whole dosage in a capsule and do it orally, and I've had people put their whole dosage into a homemade coconut oil capsule that they freeze, and then they use that coconut oil capsule from a little mold with coconut oil that they do as a suppository before they go to bed. So there's multiple ways to get that in your body, but you do have to ramp up on it. But don't think that, be careful of websites that you have out there that say anything is an end-all be-all for cancer. So you have to get this from a state that legally you could get this from, and you can get it on order from multiple places if you search online.